to our introduction. All right, good morning again, all. It is my pleasure to introduce Ayanna Johnson, Policy Advisor for the U.S. Department of Health and Human Services. Ayanna Johnson is a public health advisor in the Office of Disease Prevention and Health Promotion. She manages Healthy People 2020 strategic partnerships with state health departments and other non-federal organizations. She is leading ODPHP efforts to host regional meetings on healthy aging policy and practice across the country. Ms. Johnson focuses on a variety of public health issues, serving on working committees for the Department of Health Equity, Women's Health, and Adolescent Health. Ms. Johnson also supports external outreach by hosting listening sessions with public health professionals to inform the development of Healthy People 2030. Prior to joining ODPHP, Ms. Johnson joined the Office of the U.S. Surgeon General as a Health Policy Fellow for the Division of Science and Policy. Previously, she was a Health Policy Manager at the National Consumers League, focusing on consumer health, health professional graduate training, and chronic disease management. She holds a Master of Science in Public Health from the Johns Hopkins University Bloomberg School of Health. We are very excited to have Ayanna Johnson with us today as she gives an overview and outlook for Healthy People 2030, the next 10 years agenda of the U.S. policy for a healthier nation. I'd like to introduce Ms. Ayanna Johnson here. Ayanna?
Hi, good morning. Thank you so much for that wonderful introduction. Would you like me to go ahead and share my slides?
Yes, please. I have just forwarded the presentation screen over to you. We do see your desktop.
Okay, great. And what about now? You should see the full slides.
And we see the full presentation.
Okay, great. Thanks, everyone. So good morning, and I'm delighted to join you all virtually to discuss the development of Healthy People 2030, the nation's disease prevention and health promotion agenda. For today's talk, Developing Healthy People 2030, a prevention roadmap to address the social determinants of health, I will provide a snapshot into how the U.S. Department of Health and Human Services developed this next iteration of the Healthy People initiative. When I originally was invited to speak, I thought that we'd be able to share with you today our newly unveiled iteration of Healthy People. However, with the COVID-19 pandemic, the launch has been postponed from March 2020 to later this year in August. Today, I plan to describe how the nation's prevention agenda can be used to understand and address the social determinants of health. I will also share the progress we've made toward achieving Healthy People goals for 2020 related to mental and behavioral health. And by the end of today's talk, you should have a better understanding of what Healthy People is and how it can be used as a resource for your work. So since we're virtual, I thought it would be nice to share a picture of myself, and I'm a public health advisor in the Office of Disease Prevention and Health Promotion. Many people may not know this office, but we sit in the Office of the Assistant Secretary for Health at HHS. At ODPHP, we fulfill our mission by guiding the nation toward better health through disease prevention policies and programs. ODPHP, or the Office of Disease Prevention Health Promotion, is home to the National Clinical Care Commission, which is developing recommendations on federal programs related to diabetes and also supports 2 national action plans to improve healthcare quality. We are home to the U.S. Dietary Guidelines for Americans, a set of food-based nutrition guidelines designed to support the development of healthy eating patterns and help prevent chronic disease. We also house the Physical Activity Guidelines for Americans, which are a set of guidelines designed to help people improve their health through physical activity and encourage people of all ages, shapes, and sizes to get active through our recently launched Move Your Way campaign. We also are home to the President's Council on Sports, Fitness, and Nutrition, which promotes health through good nutrition and physical activity across the nation. And in addition to those 3 items, we also encourage people to get recommended preventative services and adopt healthy behaviors by making health information user-friendly for all Americans. We manage healthfinder.gov and a number of health literacy initiatives as well. And of course, what the focus of today's talk will be, we are home to the Healthy People initiative. So in Healthy People 2020, HHS put forward a vision of a society in which all people live long, healthy lives. In preparations for today's talk, I took a look at the Cultural and Linguistic Competency Initiative of the Division of Mental Health and Addiction. One of your goals, to address the needs of unserved or underserved population, which are linked to common factors such as issues with poverty, mobility, housing, and education, aligns with our work in ODPHP with the Healthy People Initiative. We are aiming to create health in the communities where people work, live, learn, play, and worship. So I know that you guys will understand this work and it's important. And we like to stress in Healthy People that the importance of working with organizations from all sectors is key. I notice also that you all have partnerships with schools, businesses, communities, criminal justice systems, minority health organizations, and other groups that are all working to improve service delivery and the mental health and well-being of your community. So we align. So this slide here shows the evolution of the Healthy People Initiative over the last 4 decades. Healthy People has established benchmarks and monitored the progress of our nation over time in order to encourage collaborations across communities and sectors. It offers a model for program planning at the state and local level. We also provide a strategic framework for the National Prevention Agenda that, of course, communicate our vision for improving health and achieving health equity. And Healthy People also has key to that are our science-based measurable objectives with targets to be achieved by the end of each decade. And we also track data-driven outcomes and monitor the progress to motivate action and guide where we need to go. On this slide, you will see the evolution of Healthy People Initiative since its inception in 1979 with the Surgeon General's report on disease prevention and health promotion. When we launched Healthy People 1990, there were 226 objectives. And as you can see, over the next few decades, Healthy People has grown substantially. In our current decade, Healthy People 2020, we have over 1,200 objectives that we are tracking or at least monitoring in some way how the nation is progressing on various health indicators. And of course, we are in the process right now of getting ready to launch Healthy People 2030. But because, as you can see, the initiative has grown substantially over the last 4 decades, in 2030, we are hoping to launch with a much smaller initiative, which I will get into later in today's presentation. So in Healthy People, we define the social determinants of health as the conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. The Healthy People Social Determinant of Health framework takes a place-based approach, or more simply put, we emphasize that good health begins in the places where we live, learn, work, and play, and that where you live really does matter. And I like this graphic here because it shows a nice community where everyone is able to live and receive the services that they need and hopefully are healthy and have well-being. And that's what we like to think of when we envision our nation over the 10-year period. On this slide, you will see our Healthy People Social Determinants of Health framework and also broken out. We've identified 5 domains: economic stability, education, health and healthcare, neighborhood and built environment, and social and community contexts as impacting health outcomes. The Healthy People Social Determinants of Health framework also includes 19 key factors that you can see listed underneath each of the domains. These are subdomains which make the social determinants of health more concrete. They're areas where many Healthy People objectives fit and help increase the public's understanding of the social determinants of health. Many of these factors we know are inequitably distributed across and within our communities. For example, key issues within the neighborhood and built environment domain include the quality of housing, levels of crime and violence, and access to healthy foods. We know that women, communities of color, and those of lower socioeconomic status are more likely to lack safe housing or access to healthy foods and experience crime and violence. This means that individuals in those communities face higher barriers to achieving optimal health for themselves or their families. And for instance, for another example, if we look at poverty among children, we know that that is associated with a wide range of negative social and health outcomes. Some of those examples include poor overall child well-being, low birth weight, low educational attainment, physical inactivity, childhood obesity, sometimes often reports of feeling lonely, and other mental health problems. The wide range of negative social and health outcomes associated with children who grow up in poverty makes it especially important to monitor the social determinant of health and improve that aspect. On this slide, you'll see one of our key aspects of Healthy People that was introduced in Healthy People 2020 are our leading health indicators, or also known as LHIs. The leading health indicators are a small subset of the Healthy People objectives. This decade, there are 26 leading health indicators organized under the 12 topic areas that you see here. The leading health indicators communicate high priority health issues and the actions that can be taken to address them. They promote population health, access to quality health care and services for all, and focus on individual and social determinants of health. The leading health indicators also serve as the general public's gateway into the larger set of Healthy People goals and objectives. We have two leading health indicators for mental health and mental disorders in Healthy People 2020. One on major depressive episodes in adolescents and one on suicides across all age ranges. The next few slides will go through our current data, which help to shape the proposed objectives for inclusion in Healthy People 2030. On this slide, we see our latest data on the percent of adolescents aged 12 to 17 who experienced a major depressive episode, broken down by sex from 2017 through from 2007 to 2017. At the beginning of the decade, we wanted to see a decrease in this percentage. The baseline in 2008 was 8.3% of adolescents had a major depressive episode within the last 12 months. In 2017, that rate increased to nearly 15% for both females and males. And we see that a higher proportion of adolescent females aged 12 to 17 had a major depressive episode in the past 12 months compared to adolescent males. That rate is 2.5 times higher for females than males. When you look at this objective broken down by race and ethnicity, we see further disparities growing over time. There are currently higher rates of major depressive episodes seen among all races compared to non-Hispanic Black adolescents. And you can see here, both Hispanic and non-Hispanic whites have some of the highest rates of major depressive episodes with our latest data. And this data comes from the National Survey on Drug Use and Health from SAMHSA. This graph shows the latest data for age-adjusted suicide rates by sex over the decade. Again, we see that as a nation, we are well above our 2020 target of 10 deaths per 100,000 of the population, and that a disparity exists among suicide deaths between males and females, with males having higher rate of suicide. When you dig a bit deeper, we can also see the stark racial disparities emerge as well. Non-Hispanic whites and American Indian or Alaskan Natives have suicide rates that outpace the rest of the nation. And on this slide, we also took a look at the recent data to show the disparities in age-adjusted suicide rates by geographic area, where we see persons who reside in non-metropolitan areas had a rate of suicide 1.4 times those in metropolitan areas. So this current data and where we are as a nation with all of our objectives and topic areas has driven the selection and framing of Healthy People 2030. So now I'll talk about our Healthy People 2030 development. Healthy People prides itself on being a federally led, stakeholder-driven initiative. This development is a multi-year process with input from a diverse group of subject matter experts, organizations, and members of the public. ODPHP works with a variety of agencies across the federal government to develop and implement Healthy People and to ensure that the initiative aligns with federal programs and policies. To develop Healthy People, HHS established a federal advisory committee composed of non-federal subject matter experts who provided independent recommendations to the HHS secretary on the initiative. Over the past few years, the committee has provided recommendations on the 2030 framework, our summary measures, data requirement, health equity, complex system science, and stakeholder engagement and implementation efforts. We also have a federal interagency work group, which provides ongoing oversight and guidance for the initiative. And this work group is made up of representatives from more than 30 federal departments, agencies, and offices across HHS and others within the government. And we also have topic area work groups who lead objective development and target setting for 2030. And of course, we have public engagement through our numerous public comment opportunities that have helped inform the development and implementation of Healthy People. Over the past 4 years, ODPHP has been diligently working to develop Healthy People 2030. This began with the creation of the framework for the next decade based on recommendations of the Secretary's Advisory Committee on National Health Promotion and Disease Prevention Objectives for 2030. And the framework for Healthy People 2030 was finalized and released in 2018. Secondly, in 2018, we also began the internal process of developing a new set of objectives, which were shared for public comment in January of 2019, and I will be sharing a few of those proposed objectives today. Based on feedback from Healthy People users, HHS has also decided to reduce the number of objectives in 2030 by half. So 2030 will be a smaller initiative with approximately 356 objectives, which you can see is significantly less than the 1,200 objectives that we currently have in Healthy People 2020. And we will be launching Healthy People 2030 on August 18th. So generally, there are 5 key elements that distinguish Healthy People 2030 from previous decades. Over the next few slides, I will dive deeper into some of the expected changes and to help orient you to the new initiative. In addition to our organizing framework, the 2030 will be a streamlined set of objectives with data that adhere to strict standards in most cases and are of national priority. We will also have 3 new objective categories: core, developmental, and research objectives. We will launch with a brand new website that will feature a more intuitive design and organization of objectives. And finally, we will continue to support unique partnerships with groups like the American Public Health Association or the Association for State and Territory Health Officials to communicate to the nation about our national prevention agenda. On this slide, you see a portion of our Healthy People 2030 framework. For Healthy People, this is really the driving force over the next decade. In 2030, we envision a society in which all people can achieve their full potential for health and well-being across the lifespan. The 2030 framework includes a vision, mission, overarching goals, plan of action, and guiding principles. I wanted to highlight a few of the nuances in our overarching goals for Healthy People 2030. In 2030, we want to attain healthy, thriving lives and well-being free of preventable disease, disability, injury, and premature death for all Americans. In 2030, our framework builds on our understanding of the determinants of health by noting that creating physical, social, and economic environments that support health and well-being is important. Another key element for this decade is the calling out of engaging key stakeholders and external leadership to take action and design policies that improve health. And another goal is also to eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being of all. So you're probably wondering, how did we get from 1,200 objectives to a little under 400? And this slide provides a quick snapshot into how we reduce our objectives for this coming decade. First, we held a sort of two-phase approach. In our first approach, used an initial assessment criteria that had two data-related selection criteria, noting that an objective to be included in 2013 or 2030 must be measurable by 2019 and have a baseline with data that is no older than 2015 and expected to have 2 additional data points throughout the decade. Each of our 42 topic area subject matter experts determined which Healthy People 2020 objectives qualified for inclusion in 2030 using this initial assessment criteria. This yielded about 700 objectives. Then, in addition to the initial assessment, we conducted a second round, which used 3 additional criteria. One, we asked, do these objectives satisfy the 2030 criteria for national importance, evidence-based, and addressing health equity? We wanted to make sure that these objectives reflect top national public health priorities and are there new objectives that are needed to address critical issues that have arisen in public health over the last 10 years. In selecting objectives for inclusion in this next decade, we placed strong emphasis on identifying objectives that, if achieved, would improve health equity or reduce health disparities. We also aim to include objectives that have population-level data like sex, race, ethnicity, geographic location, income, educational level, age, sexual orientation, or disability status, so that we can really see health disparities and track them. In 2030, we will have 3 objective types, which is new for Healthy People. The first type, core objectives, are our measurable objectives with the reliable data, which fit the criteria that I explained earlier. These objectives, of course, will have a direct impact or influence on health, and they represent a substantial burden on the population. We have also updated the data requirements, as I earlier discussed. Our other 2 objective types, developmental and research objectives, fill gaps in our core set. Developmental objectives represent high priority issues with evidence-based interventions, but they do not have a reliable baseline data. Research objectives may or may not meet core objective data requirements and do not yet have evidence-based interventions developed. These objectives represent significant opportunities for progress in areas with limited research. Together, these objectives in combination with the core objective provide a more holistic view of the important issues facing our nation's health. We will also be developing a new set of leading health indicators based on our core objectives and establishing global overarching summary measures of health to be released later in the decade. A defining feature of Healthy People is that we set targets. All of the core objectives will have aspirational yet achievable goals for where we want to be at the end of our 10-year period. Healthy People 2030 aims for greater transparency and a more systematic approach in target setting. Target setting documentation, including our justifications, tools, and technical guidance, will be provided on the Healthy People website after the launch. This will allow for replication of our target setting methodology at the state and local level, and for targets to be considered using data-driven tools. This decade, Healthy People targets reflect alignment with subject matter expertise, national agenda, policy considerations, or they use projections or trend analysis, or they support a statistically significant change. I wanted to circle back to how we are addressing issues of equity and determinants in Healthy People 2030, which I know are so relevant to the populations you all see in your practices. For Healthy People, health equity is the attainment of the highest level of health for all people. We plan to continue to play a critical role in monitoring and surveillance of inequalities and inequities between more and less disadvantaged social groups to draw attention to these issues and motivate action to change them. In 2030, we will operationalize the overarching goals to shift away from focus on disease outcomes to understanding that many public health issues are driven by a wide array of forces. The Healthy People Advisory Committee recommended that HHS continue to have a distinct topic area for social determinants of health, and for the first time in this decade, have targets or a goal to reach for each of those objectives. In 2020, the social determinants of health objectives are informational only and do not have a target. On this slide, you see a snapshot of the current Healthy People social determinants of health objectives in 2020. The approach taken last decade was to identify objectives in the key domains that were not addressed in other Healthy People topic areas. To develop this full set of objectives, the work group took a look at the existing objectives and decided what would make sense as to being related to one of the 5 determinants in the Healthy People framework. And they also developed new objectives that address some of the gaps that they saw. We have objectives on poverty, children living with at least one parent who's employed full-time. We track or monitor the proportion of income spent on housing and the percent of high schoolers who complete high school and then enter college in the next October. We also in 2020 tracked the proportion of children who experience a parent who has ever served time in jail, and also the proportion of persons eligible to participate in elections who are registered to vote. These next few graphs provide a look at where we are as a nation for the social determinants of health indicators in Healthy People 2020. We know that more people of color are living in poverty, but we are also seeing overall declines in that percentage over the last decade, as evidenced by this slide. On this slide, we look at the percent of households who have spent more than 30% of their income on housing, which we call being housing burdened. And the latest data, unfortunately, is from 2013. We know that for over 70% of Americans who live below 100% of the federal poverty line are housing burden. We know that individuals who are housing burden have less money to spend on things like food, healthcare, and other basic needs. On this slide, I wanted to show our most recent data for children who are under 17 and live in poverty by race and ethnicity. We have seen a downward trend over time in overall childhood poverty levels, but again, we see that Hispanic and non-Hispanic Black children represent the highest percentages. The previous slides gave us a snapshot of where the nation currently is on objectives tracked in Healthy People 2020 on the determinants of health. Based on our current status, our objective criteria, what you see here on this slide are the objectives proposed for inclusion in Healthy People 2030, which was made available to the public in 2018 and 2019. Of course, there are many social determinants of health-related indicators in the initiative, but this is just a snapshot of the ones in the specific SDOH topic area. The objectives are very similar to what we have now and track poverty, enrollment in higher education, housing burden, one of the adverse childhood experiences, children who have a parent who has served time in jail, employment among working age individuals 16 through 64, and the research objective to increase federal data sources that collect country of birth as a variable. On this next slide, and hopefully you can see it, but this is the 15 measurable mental health and mental disorders objectives that are in Healthy People 2020 and their final status at the end of this decade. In 2020, we have seen that 6 objectives in the mental health and mental disorders topic area are getting worse or moving in the opposite direction of the target. For instance, suicide rate in adults 18 and older with major depressive disorder who receive treatment are among those 6 objectives getting worse. We have 2 objectives that have met the target or exceeded it. Those are increasing the proportion of primary care providers who screen adults 19 and older for depression at an office visit, and increasing the proportion of homeless adults with mental health problems who receive mental health services. 5 objectives had little or no detectable change. Those include increasing the proportion of children with mental health problems who receive treatment, increasing the proportion of juvenile residential facilities that screen admissions for mental health problems, and employment among persons with serious mental illness. Based on the data and the public health priorities, here are the proposed objectives for mental health and mental disorders topic area. You will see that the topic area cut many of the objectives that needed improvement. Reduce the suicide rate, reducing suicide attempts by adolescents. We also kept increasing the proportion of adults with serious mental illness who receive treatment. And some of the objectives were consolidated into one measure, like screening for depression in both adolescents and adults. On this slide, the work group also, you will see some other proposed objectives by the work group and other topic areas that are relevant. They proposed 2 objectives that did not have enough data or evidence-based interventions for monitoring over the decade. The first one, which is developmental, is increase the number of youth with serious emotional disturbance who are identified and receive treatment. And a research objective for this topic area, increase the proportion of homeless adults with mental health problems who receive mental health services. I've also included other related objectives to give you a sense of what we will likely be monitoring in the new decade. This includes some objectives on opioids. 1, reducing the proportion of people with opioid use disorder in the past year, reduce overdose deaths involving opioids among all persons, and increase the proportion of people who need alcohol or illicit drug treatment and receive specialty treatment for substance use problem in the past year. So now I want to share with you what else you can expect once we launch Healthy People 2030 in August. And we like to think of it as our new, leaner initiative. When we launch 2030, we will also be unveiling a brand new website that incorporates years of user studies and focus group research to create a site that is more intuitive and easy to navigate as a data source. Users will quickly be able to navigate to relevant objectives based on the topics that they are interested in, which will be grouped in the 5 categories you see on the right-hand of this slide. Those are health conditions, health behaviors, populations, social determinants of health, and settings and systems. So someone they may not know what objective they're looking for or what topic area, but if they understand where it may fit within these 5 domains, it'll quickly navigate people to the objective that they are looking for. One other unique piece of our website that was not in 2020 that we will have is that individuals will be able to see objectives in multiple topic areas. So if an objective is related to mental health or substance use, they will see it even when they click on sort of health behaviors and look at substance use or healthy eating or physical activity. You will be able to see all of the objectives and all of the topics that fit into this. We're also really excited to be able to provide an interactive crosswalk between Healthy People 2020 and 2030 objectives. So that will allow individuals, if you're really familiar with Healthy People 2020, you can search the specific objective that you're interested in and figure out whether or not it has been carried over into Healthy People 2030. And if not, you can find out why. And we will also be able to have national data and objective-specific landing pages which provide a quick overview of each objective and the reasons why it was included in Healthy People 2030. These pages will be the objective home with all related data, resources, and other details specific to that objective. We will also have a number of tools and resources ready to go on the site, including a list of our evidence-based resources that align with specific objectives. We also will have an updated SDOH, Social Determinants of Health graphic and information, and we will also include the Healthy People 2030 framework. After we launch Healthy People 2030, we will continue to add additional data and resources like our leading health indicators, additional disparities data, and stories from the field, which highlight how communities, states, schools of public health and nursing and medicine, and others have used Healthy People 2030 to drive their actions and outreach. We will also provide a brand new tool that will guide individuals in using Healthy People 2030 in their work. So now I wanted to turn to the rest of the presentation over to how we are hoping to engage stakeholders in Healthy People 2030 over the next decade. Engaging stakeholder is a key focus of our promotion and implementation plan. We know that Healthy People covers so many topics, and progress on objectives really requires coordination of activities not only in the health and federal sector, but also in education, transportation, housing, behavioral health, and legal sectors. On this slide, we see our sector list. If we were to achieve our goals of changing the culture of health and well-being in America, the progress for these health objectives for the nation will require input from more than just the health sector alone. We know that in the coming decade, we will need to focus on strengthening multi-sectoral partnerships. To that end, our Stakeholder Engagement and Communications Advisory Committee subcommittee developed a set of recommendations for Healthy People 2030. One of those key products and recommendations that was to develop a robust list of diverse sectors that HHS and Healthy People should engage in 2030. You'll see that we have on this list criminal justice, housing, commerce, food and agriculture, faith-based organizations, foundations and nonprofit, defense and military, energy, education, technology and IT, and identity-based organizations. The advisory committee provided recommendations on these cross-cutting sectors that Healthy People can engage, including, of course, state and local government, tribes, and territories. The Stakeholder Engagement Subcommittee also developed a sector template, which was designed to help effectively engage potential partners, and you can find that on our Healthy People website. The template leads partners through a process of developing engagement strategies by answering the following questions. What values are shared between the groups? How does this sector influence health? How would healthier people actually benefit this sector? What would a successful partnership look like? How can we facilitate better interaction and partnership? What metrics could be used to measure the success of this partnership? These questions and targeted conversations can be used to encourage greater participation of diverse sectors in developing, disseminating, and implementing Healthy People 2030. Many states and territories really do use Healthy People as a guide to improving their health. Since Healthy People 2000, almost every state and territory has a Healthy People coordinator who serves as a liaison with ODPHP. In prior decades, my office supported coordinators through grants and workshops and toolkits to guide the states in developing their health improvement plans and using Healthy People as its tool. We now provide support as needed because many states have state health improvement plans and also at the local level. And we also provide access to webinars and have used our partnership with the Association for State and Territorial Health Officials to develop new resources to transition to 2030 for state coordinators. Our partnership with ASTHO has evolved over time to provide resources, research, and tools for state and territorial health officials and staff. And we also recently produced a series of briefs with lessons learned over the last decade and suggestions for how to transition to 2030. We also have a partnership with local health departments with NACCHO, designed to increase the use of healthy people among local health departments, nonprofit hospitals, and other organizations related to community health and improvement planning. We are working to support the transition to 2030 by providing training on using local data to support national priorities. And I wanted to also share a project that currently is within Healthy People 2020, the Law and Health Policy Project. To better work on providing information about the role of law and policy in improving health, Healthy People 2020 included a law and health policy project, which was a collaborative effort between ODPHP, the CDC Program and Performance and Evaluation Office, the CDC Foundation, and Robert Wood Johnson Foundation. This project explores ways that legal and policy approaches can support healthy people objectives and overarching goals, including those related to health equity. Through reports and other products focused on healthy people topic areas and objectives, as well as webinar series, the project aims to identify and disseminate evidence-based legal and policy solutions for public health challenges. A key part of this work is highlighting law and policy in action through community examples or bright spots. These share innovative ways that states, tribes, local jurisdictions, and others can use law and policy to advance health and well-being. The project also supports the development of the next decade of the initiative, 2030, by identifying opportunities to further incorporate evidence-based legal policy tools into the initiative. And so finally, we ask that you help us support the launch of Healthy People 2030 by sharing our resources with your partners and using Healthy People 2030 in your planning, development, and technical assistance for your work. You can monitor Healthy People data to drive action and develop your targeted programming. We would encourage you to share your community examples with us so that they may serve as a bright spot for the rest of the nation. We also suggest that you use the Social Determinants of Health framework in your work and to guide your overarching principles. And of course, be sure to promote the launch of 2030 in August. So for further information on the Healthy People Initiative, including our launch and development, please head to our website, healthypeople.gov. And there you can also find our Social Determinants of Health framework and a number of smaller policy papers on each of the 19 key subdomains that I shared earlier in my presentation. And if you have any questions, please feel free to reach out to me at hp2030@hhs.gov. And with that, we can open it up for questions and comments.
Ayanna, thank you so much. We have a quick request from Alicia Sims. If you could navigate back to the cross-sector screen again, she wanted just to take a pause and review that in a little bit more thorough detail. And the slide decks, again, for those that have access, are available for download directly through the handout section. For those that are unable to access the handout section due to joining via web only, then we will have those slides available to be sent out at the end of the day. Great. Ayanna, we do have a first question from Sarah Leone at Amani Family Services. Will immigrants and refugees be given the same opportunities to access these resources?
So Healthy People is a free resource of sorts. It's available on our website, and it really is a data repository. We also have a number of tools, but it's more specific for a community organization. But yes, I would say anyone is able to use the website, use our resources, and help drive their action at the local level. But it's, more geared towards like a health department or a community organization we do have some specific individual tools and resources, but I would say that is not the focus of Healthy People.
Great, thank you for that feedback. A second question from Dessalene Roberts with Oak Lawn. Can you break down the cultures defined within the non-Hispanic Black and white categories? To clarify, she is looking for understanding how these categories are used to define groups of people within each subset, as it would be useful to understand how these health disparities affect individuals and families across cultural groups.
That's a great question. That's a little bit challenging. So I failed to mention, but Healthy People primarily has data or uses data from federal data sources. So these are data sets that are publicly available and provide national level data. So the way that the ethnicities are broken down is aligned with how the federal government reports. So generally in Healthy People, we do not distinguish by like country of origin or how someone sort of identifies within each of the racial and ethnic minority groups. And that is something that I know is challenging when you're trying to figure out which of the populations that you serve, are they represented in this data? Does it look the same? I would encourage you, if you are curious further, to check out the Office of Minority Health. I think it's omh.gov, and they have a number of resources on subpopulations within each racial and ethnic minority category.
Great resource, thank you.
Mm-hmm.
From Alyssa Piscini, mental health is viewed very differently across different cultures. Including this in the Healthy People 2030 might be helpful in understanding how mental health is actually approached. How have you seen different mental health approaches be submitted through different case studies across the country?
That's a great question. And I don't know all of them off the top of my head, but we have had examples from Native American populations, Asian American, and other groups that are being served. I can direct you to where to find further information. If you go to our website and you check Healthy People in Action at the top, there is a tab called Stories from the Field, and it shows a map of the country and also the the different topic areas and what we actually have available online. So when looking at mental health and mental disorders, we have about 7 bright spots or stories. One that is looking at one actually from Arizona that is looking at adult or teen suicide using evidence-based resources from the White Mountain Apache tribe. We also have examples from Michigan with the Zero Suicide Organization and what they have been doing to fill healthcare gaps in preventing suicides in Michigan. We also have another example from a community called Sources of Strength and how they've been helping youth to build their strength to prevent suicide. I would say those are, and then the other examples that we have kind of across all sectors. We also have an example from Zero Suicide in Texas and a group in New York that focus specifically on seniors. So hopefully some of those will be of use to what you're looking for. But one thing that we definitely want to make sure that we do in Healthy People 2030 is to really find more community examples, more evidence-based interventions that actually that are targeted and specific to different cultures and different populations. So please do share if you have examples on your own or are familiar with additional.
Ayana, a logistics question regarding how to share. What are the best ways to submit that information, and how can our local providers also ensure that they're connecting with their state coordinators as well?
Great. We have on our website, again, there is a tab. Everything probably you all would like and need are under the Healthy People in Action tab and the Tools and Resources tab. So under Healthy People in Action, we have the full list of the Healthy People state coordinators, if there is one in the state, and it has the person's name and also a link to the state health improvement plan that they are monitoring and evaluating. So that would be the great first step to connect with your state coordinator. And we try to keep it up to date, but I know that people move jobs often, but so far that's as up to date as we have recently. Then you can also find additional things under our tools and resources. I would say the best way, there is a way to sort of submit stories, but I would say the best way at this point, because we are transitioning to a new website, is to actually email this email here, hp2030@hhs.gov. That is the best way to make sure that we hear your story and can potentially carry it over to the new website.
Great resource. We have another question on understanding the crisis of suicide. So the question is, what about the statistics and rates of suicide among Black and Hispanic youth of color? Is this statistic being tracked? And what are some recommendations? These youth are often unhappy, irritable, and angry, which seem to indicate mental health issues such as post-traumatic stress disorder, traumatic childhood experiences, depression, anxiety. What is being done to address these specific populations?
Yeah, that's a great question. So let me go back to the objectives that we have in 2020. So yeah, we know that over this last decade, we've seen a huge increase in suicide ideation and attempts in youth, and especially men of color. And I think that is a focus of some upcoming work or ongoing work really at SAMHSA. So I would encourage you to check out the Substance Abuse and Mental Health Services Agency for their up-to-date research and specific programs. If you are on our website, I think you could take a look at any one of these objectives that you see here, and you could click on the data, see where it actually came from, and also see specific evidence-based resources. Unfortunately, that's not my area of expertise, so I don't know them off the top of my hand. But yeah, it's something that we definitely want to track. So you'll see here the proposed objectives. All of these objectives, at least when we launch, will have our national baseline data and the target for the nation as a whole. But within the first few months of launching the initiative, we will be able to share or provide the data as it's broken down by the demographic and population factors, so race, ethnicity, age. So you'll see for mental health disorders, number 2, suicide attempts by adolescents, that would be broken down by all of the factor or the demographic populations that you mentioned in your question. And we would have a much cleaner and clearer link to the resources to address that. But for the interim, I would say definitely check out SAMHSA, because I know that they have a new initiative for that specific population group.
Fantastic. Thank you so much, Ayana. And certainly for all of our attendees, please do download Ayana's slide deck here so that you have access directly to the hyperlinks that will redirect you to the appropriate places within Healthy People 2030 as a great dashboard and resource tool. We have 5 minutes left for the session one, and we are welcome to invite and ask any further questions. So please do take a moment to type in your questions for Ayana into your question pane. And as we are waiting for any additional attendees to introduce additional questions, Ayana, when you look at the objective statements for the suicide rates and overall mental health impacts, what will be the frequency of information update as case studies, submission reports, details and data are rolling in? How frequently will this dashboard be updated to showcase tracking and progress?
So it depends on each objective. So some of these are reported by the federal government annually. So as soon as that data is available, it would be up on the website. Others are reported a little less frequently. So the nice thing about our new website is that once the data is available, we can do a quick, easy update. So our goal in 2030 is to have the data, once it's available, be online as soon as possible. We've done a lot of like restructuring of the website and the tools that we use so that it is there in a more timely manner. But the nice thing that you'll be able to see is on our website as well, for each data source, we have a field that says like how often it's collected so that people can be aware. Resources and things like that will be updated as well as often as we have them. So we work with our partners across the government who help us identify those evidence-based resources and tools. We have a pretty strict criteria, so I think sometimes that makes it harder to see what everything that's going on, but because we really do only share the best science, or at least examples that really have met a certain level or threshold. I think the place where we will see a lot more stories is really from our stories from the field and other action steps that are done by our partners. And so we do plan to include it as frequent as possible. But again, it really varies on the specific objective and what data source that information is coming from.
Great. Thank you for that. Mm-hmm. And as we go into the launch of the Healthy People 2030 in August, where can the attendees go to sign up for more information and to keep pace with updated data information ongoing?
Yeah, so you can go to our main website, healthypeople.gov, and there is a button that's like add me to this list, and you can make sure that your email is added. We haven't released the sign up yet for our virtual event, launch event. Of course, it will be virtual, so anyone is available to view it, but that information will be posted probably in early July on healthypeople.gov. But in the interim, you can make sure that you sign up for our listserv. If you go to the main website and scroll all the way down to the end of the page, there is usually a little blue banner on every single page that says enter your email for updates, and that will have you added to the Healthy People listserv.
Fantastic. We have one last question from the attendees. Brittany Crone with the Westside Community Development Corporation in Indianapolis asks, regarding the data around major depressive episodes in youth, is that measured specifically by adolescents who are admitted to a mental health facility? How is the episode defined?
That's a great question. Let me pull up the data for you. Well, I'm pulling it up on another screen, but I will let you know how it's defined. So that objective, that data, reduce the proportion of adolescents 12 to 17 who experience a major depressive episode, comes from the National Survey on Drug Use and Health. And it is defined through a series of questions, but it's self-report. So it's asking the children, have you ever in your life had a period of time lasting several days or longer when you felt sad, empty, or depressed? And it goes on and asks a number of questions related to that. And so, yeah, gosh, it's like 12 or 20 different questions. And based on the responses and the way someone is rated, then they are identified as having a major depressive episode. Yeah, that. And it was a question also asking about those who had been seen, but no, it's a self-report. So based on how the person defines their own depressive symptoms. But it's using the same diagnosis criteria based on DSM-4.
Great, thank you. Yes, that does fully answer Brittany's question. Great question in understanding and showcasing the data sources that have been compiled through Healthy People 2030.
Yep.
We are at 10:47, but we have one last question from Jamie
Sure.
Steiner. Were you able to collect data from that survey for 2019 as the children were out of school towards the end of year?
Ooh, that's a great question. The latest data that we have right now is from 2018. I do not know how data collection has occurred right now. It is done annually, so our 2019 data, we wouldn't get till sometime later this year, but it might affect 2020 data. But we do not, Healthy People, my office does not administer that data source, so I can't actually answer that question.
I think that's a great clarification question, either way, to account for how COVID-19 certainly will be impacting the ability to gather data sets and where we're going to be within data compilation and review of data as we move forward with programs. I think in general for our local community providers, our mental health and addictions providers, is to ensure that as you're continuing to provide programming that you're in connection with your local and state government funders to ensure that your data is being passed through so that as we are going through the federal resources and presenting those dashboards for Healthy People 2030, that it is flowing towards the ODPHP team.
Great, exactly. Thank you so much for having me, and I look forward to working with you all and learning more about your work. So please do reach out and keep us connected. So thank you so much.
Ayanna, thank you so much for all your time and all your great work with ODPHP. We look forward to the August Healthy People 2030 unveil, and we'll certainly be submitting field information into the website from the state of Indiana. Thank you so much for all your support.
Great, thank you.